Kidney stones are made up of minerals and salts that form inside our kidneys and can affect any part of your urinary system, that is, from kidney till the bladder. As an estimate, about 1 out of every 10 persons will develop a kidney stone during lifetime. However, these may not cause any damage if they are timely detected and treated. In today's episode of Explainable TV, we will learn what are kidney stones, how they are formed, and most importantly, how they can be prevented or treated. If you have not subscribed to our channel yet, don't forget to subscribe now for more weekly videos to learn new concepts in simpler way. So first of all, let's look at what is a kidney stone and why it can form. The urinary system's function is to filter blood from waste products. Kidney is the most important organ of this system that is mainly responsible for cleaning up the blood and remove waste products from our bloodstream in form of urine, which mostly contains water, sodium, calcium oxalate, potassium, phosphate, and uric acid. Kidney stones are usually composed of minerals such as calcium, oxalate, phosphate, magnesium. It is a three-step process, which includes crystallization, aggregation, and crystal growth. During the crystallization stage, if the level of these particles increases, or the urine becomes too acidic or basic, the excess particles join together over time and crystallize. Calcium oxalate is the most common type of crystal to form this way, and accounts for about 80% of kidney stones. Less common kidney stones are made of calcium phosphate, or uric acid. A slightly different type of stone made of the mineral, magnesium ammonium phosphate, can be caused by bacterial infection. And even rarer stones can also result from genetic disorders or certain medications. During the aggregation stage, many other substances can attach to these crystallized minerals. Finally, during the crystal growth stage, the crystals will gradually grow over a few weeks, months, or even years, forming a detectable stone. Do you know the biggest kidney stone ever recorded weighed more than 1 kilogram and was 17 centimeters? So this was about the kidney stone formation process. But how a kidney stone is actually detected? A kidney stone can go undetected until it starts to move. When a stone travels through the kidney and into the ureter, its sharp edges scratch the walls of the urinary tract. Nerve endings embedded in this tissue transmit pain signals through the nervous system. And the scratches can even sometimes send blood flowing into the urine. This can be accompanied by symptoms of nausea, vomiting, and a burning sensation while urinating. If a stone gets big enough to actually block the flow of urine, it can create an infection, or backflow, and damage the kidneys themselves. But most kidney stones don't become this serious, or even require invasive treatment. Now we know the basics of kidney stone formation and detection. So how can a kidney stone be treated? Stones or crystals less than 5 millimeters in diameter will usually pass out of the body on their own. A doctor will often simply recommend drinking large amounts of water to help speed the process along, and maybe give some painkillers. If the stone is slightly larger, medications like alpha blockers can help by relaxing the muscles in the ureter and making it easier for the stone to pass through. Another medication, called potassium citrate, can help dissolve the stones by creating a less acidic urine. For medium-sized stones, up to about 10 millimeters, one option is pulverizing them with sound waves. Extracorporeal shock wave lithotripsy uses high-intensity pulses of focused ultrasonic energy aimed directly at the stone. The pulses create vibrations inside the stone itself and small bubbles break it. These combined forces crush the stone into smaller pieces that can then pass out of the body more easily. But zapping a stone with sound waves doesn't work as well if it's simply too big. So sometimes, more invasive treatments are necessary. Like optical fibers can deliver laser pulses to break up the stone. Stones can also be surgically removed through an incision in the patient's back or groin. But why go through so much pain? How about avoiding kidney stone from developing in the first place? There are 3 major risk factors which can contribute to kidney stone formation. If there is history of kidney stones in your family, you are also at a risk of the same. Second and most common reason is your lifestyle, especially your poor drinking and eating choices. Lastly, stone can also form due to medication or certain infections. Luckily, there are some lifestyle changes you can adopt in order to avoid it from developing in the first place. For people prone to them, drinking plenty of water dilutes the calcium oxalate and other compounds in your urine that eventually build up into painful stones. Foods like potato chips, spinach, and beets are high in oxalate, so limiting them in your diet may be helpful. Lastly, having an active and healthy lifestyle will contribute to your overall well-being, with less chances of kidney stones as well. Let us know in comments below what your experience of kidney stone is, and what helped you getting rid of them. If there's another story or topic you want to get your head around, let us know in comments. In the meantime, check out our recent episode on how to take great naps, and make sure to subscribe to our YouTube channel.